I'm Dr. Molly with Your Goals Physical Therapy, and I help active adults prevent and recover from injuries, stay fit and healthy so that they can keep doing the activities that they love to do without having to take medications or have surgery. And today I'm going to kind of go over how I like to use my foam roller to stretch out my IT band. So for those of you who aren't familiar, your IT band travels from actually it starts at the bone. There's a little muscle that attaches up here, and then it travels all the way down to your knee. So when people are tight in their IT band, typically they have popping in their knee, maybe their hip aches. I find that runners typically are obsessed with the foam roller, sometimes foam rolling multiple times a day. And in addition to people who do very dynamic movements, people who like to jump a lot with whatever their workout is. So if you find that foam rolling helps, that is fabulous, because sometimes this can be a replacement for a massage if you can't get in to see a massage therapist. It helps with stretching, so some people just implement these with their regular stretch routine, which is fabulous. This is probably the best thing for loosening up that IT band, if that's something that really bothers you. But if you find that even if you use this multiple times a day, that IT band, your knee is still popping, that hip is still achy, maybe your squat form is suffering, or things are popping while you're jumping, or you get clicking when you're running, that might be a sign of a little bit of an imbalance in your muscles. It may be a ligament that's super tight, or there's some imbalance between your quad and your glutes. So having somebody look at you while you run or working out, whatever it is that's causing that, you might be able to find out what the imbalance is, and then that way you don't feel like you have to reach for this multiple times a day to get relief from the popping, the clicking, the aching sensation that you can get, that this does really help resolve. So now for the good stuff. So my way of foam rolling, and I like to turn my foot. So the big thing with being on the foam roller is you have to practice relaxing, right? Because it's very hard when you're first trying to relax while you're on here. And then to kind of go slow. Because if you go really fast on here, you're not getting as much of the relaxation and the stretch as you can. Again, that takes a little bit of time because these things are pretty brutal. I'm going to show you a way that you can lift up with a supporting leg so that you don't have to put all your body weight on here, so that you can kind of ease that up, and maybe if there's a sensitive spot you can ease up off of it so that you can keep relaxing. Alright, so my starting position is, I'm going to start this by my knee so I can lean, right? So the top leg I cross over and I put it firmly on the floor, right? So my foot is flat. And then the bottom leg, the one that's going to be rolling on the foam roller, I like to start with it by my knee, right? And then see how my foot is kind of parallel to the floor? That's how I start, right? Because this is kind of the easier one for me. And you just slowly go. So I can use this leg to press myself up if I need to, so that I don't have to put all my weight, and I can slowly relax into some painful areas. So then you just go back and forth. Now, the other position that I like is, you see how my foot, the bottom foot has now turned the toe up? So I can go back and forth and kind of get like the hamstring part, right? Where it kind of gets to the back part of your leg. That for me is not that painful, but for some people that is. Now the one that always gets me, that I really have to practice relaxing on, is when I turn kind of forward, right? And then my toe is pointed down on that bottom leg, and I'm just going nice and easy. And this is where, if I had to, I would lift up, because this gets very painful on me. And I just go nice and easy back and forth. Now, everybody's a little different for how long they go on one of these. You can, do it for a number of rolls, or you could do it for time. That's really kind of up to you. You just want to feel like when you're done, the side of your leg feels looser. Maybe the ache in your hip is gone, or if you were to do this before your workout, you're looking for the knee not to be clicking when you're done, right? So that you could do this right before you did squats or something, and then Hopefully now your knee doesn't click as much or at all. Well, that is how I like to use my foam roller. I hope that information is helpful. If it is, please comment in the sections below and share this information with anybody who might need it. Thank you.